last speaker this morning is Dr. Andrea Wolf. She's a chest surgeon at Mount Sinai, the place that I trained at and learned about my asbestos materials and background, training with Dr. Selikoff. And it's wonderful to have colleagues that are continuing that at Mount Sinai. And we'll have Dr. Wolf present on some of her experiences with caring for patients and operating on patients that have had asbestos-related cancers and other diseases.
So as with any talk, I always start by saying I have no financial disclosures because I don't, but I confess a major disclosure, particularly for this audience, and it's actually one I'm very proud of. I work at Mount Sinai. I've worked there for 10 years. It's the home of the Selikoff Center. It is the center where Dr. Selikoff discovered the relationship and publicized the relationship between asbestos and the cancers it causes. Linda asked me to speak about something that is very near and dear to me, and that's taking care of patients with mesothelioma and asbestos-related diseases. So I'm approaching this talk with a roadmap or a plan for screening, diagnosis, and treatment. Now, screening is done to look for disease in an asymptomatic population. So the classic example of this, that is a population of patients without any symptoms. So the classic example is the mammogram. It's done to look for breast cancer in women without any lump or detectable mass. That's different from a diagnostic test. A diagnostic test is done to look for disease in someone who has symptoms. So here, this is a chest CT in a man, a 78-year-old man who had worked in the shipyards when he was young. And he had presented with shortness of breath and was found to have a pleural effusion or fluid in between the lung and the rib cage. And he underwent a number of tests because initially it was not clear what was causing this. But that little kind of circular thing on the left side of your field, which is on the right side of the lung, represents that pleural effusion. He was later found to have malignant pleural mesothelioma. Linda and the folks at the ADAO can tell you they routinely field calls, texts, emails, and other contact from people affected by asbestos. That includes patients and caregivers of patients with asbestos-related lung diseases like mesothelioma. But not only these people, also people who've been exposed to asbestos, like Dr. Moline's patient who had asbestos-contaminated talc placed in his chest. So there are currently no good screening tests for mesothelioma or asbestos-related lung disease. As Dr. Black discussed in his Libby amphibial-exposed patients, low-dose chest CT, breathing function tests, these can help and may be appropriate, but there is currently no accepted standard of how to screen people who've been exposed to asbestos. The best right now we can offer is regular medical care. People who've been exposed really need to check in with their doctors. Providers need to have a high index of suspicion for disease, for symptoms such as chest pain, shortness of breath. This is not meant to instill panic or fear in asbestos victims. It's instead meant to inform, arm, and empower you. You need to get ahead of this. Early diagnosis is key. This requires patients to report their symptoms. Don't blow off your symptoms as aging or some other explanation. You need to talk to your doctor. Don't keep your symptoms to yourself. And the doctors, you need to ask the right questions. Dr. Moline gave an outstanding talk earlier on the questions and the importance of a thorough occupational and environmental history. This is all relevant. The doctors need to listen to their patients. There's a 20 to 40 year latency period between exposure to asbestos and the development of asbestos-related diseases like mesothelioma. You need to have a plan for regular medical care, and clinicians need to pay attention and listen to the patients, especially when they have known exposure, and the clinicians need to decipher what that exposure was in order to appropriately follow these patients. So what do you do if you have been diagnosed with an asbestos-related disease? Or, for example, mesothelioma. We encourage you to seek opinions from a center with expertise. For example, I created the New York Mesothelioma Program at Mount Sinai with the purpose of providing holistic care to patients with this devastating asbestos-related disease. Here's our team receiving the International Association for the Study on Lung Cancer Cancer Care Team Award at the 2021 World Conference on Lung Cancer. We see patients in our multidisciplinary mesothelioma clinic. We offer social support. We offer a very thorough array of multidisciplinary care that includes not only the people treating the mesothelioma directly, but also palliative care doctors, oncogeneralists, even cardiologists and psychiatrists as needed. We offer social support. We offer enrollment in clinical trials. We're actually near completion of a trial that I'm the principal investigator for that I'm very excited about, evaluating the benefit of a synthetic vaccine called poly-ICLC in patients with mesothelioma who are candidates for surgery. It's an FDA-approved drug that's been used in other cancers, but this is the first trial for patients with mesothelioma. Patients who are candidates for surgery undergo biopsy and injection in the same setting, followed by surgery 2 to 4 weeks later, and therapy as appropriate. We found that this treatment is safe, that it's very well tolerated, and we're currently analyzing the data, but we are seeing signals that in conjunction with other therapies, we're seeing some exciting responses, actual responses. Our hope that this will translate into a delay in progression of disease, a reduction in recurrence of disease, and ultimately a longer and better survival for these patients. So as I mentioned earlier, early diagnosis is key, and that means if you've been exposed, arm yourself, establish a game plan, and ask questions. And the clinicians need to also ask the questions, to gather the history, to have a high index of suspicions. That means to pursue a diagnosis. For example, the cases that Dr. Black showed of the Libby amphibile exposed patients, we have very similar stories where that is your grandfather's asbestos-related disease, and the diagnosis needs to be found early. The earlier diagnosis is made, the better patients will do. This is the CAT scan of the patient who we saw earlier. This was my 78-year-old with asbestos exposure who presented with shortness of breath, and that fluid was sampled and it was found to be non-cancerous. And if you ended there, this man would have died. But luckily, he had a family that advocated for him and a family friend who sent him to me. And we were a little more aggressive pursuing the diagnosis. He was found to have mesothelioma. And because it was early, we were able to do a lung-sparing surgery, the pleurectomy decortication, a procedure where we remove the mesothelioma and the pleural lining, but preserve the lung. And you can remove a lot of tumor that way. This is like a Kentucky Fried Chicken bucket full of tumor while preserving the lung. And this is the same patient 3 years later. So a very, very good outcome. He lived several years. Very good outcome. Early diagnosis is key. Now this is another patient. This man was 47 years old, and for years he actually had felt quite well, but in his history he had some thought to be lung infection or fluid around the lung related to an infection. He'd even undergone a thoracoscopy, or a procedure where they stick a camera in the chest, as you had seen pictures from Dr. Black's talk, without a diagnosis of cancer. And I ultimately met him and found he had come in with shortness of breath and had a CAT scan that looked like this. And again, the left is on the right and the right is on the left. So the right side of your screen, which represents his left lung was completely contracted. It was kind of consumed by this process that was mesothelioma. And so he was actually otherwise had not progressed outside of the chest, also eligible for surgery, but his operation was much bigger. And so he required removal not only of that pleural lining, but also the lung itself. And what's left when we remove the lung and the lining and the sac between the heart and the lung and the muscle between the chest and the belly, you have a big hole. So you can see the heart and the aorta there. And that's his lung, including the pleural lining, including the sac around the heart, and including the diaphragm separating the chest and the abdomen. And there's my little hand compared to that big amount of what he had to lose. He also did well, but as you can see, that's a significantly different trauma to his body and what he had to undergo. And he was 47, so he did fine with it. But you can imagine it is better to diagnose early. And that's just a lower cut. So again, no fear, no panic. Arm yourself, establish that game plan, have a roadmap. Patients and people who've been exposed need to ask questions. Seek second opinions from centers of expertise in mesothelioma and asbestos-related diseases. Don't be afraid to speak up. Don't be afraid to question your treatment plan. It's your life in your own hands, and it's important. And any clinician who doesn't receive that well is of concern to me. A clinician should not only be comfortable with that, but should encourage it, because there is no one right plan with this disease, and patients are allowed to advocate for themselves and should. Most importantly, for as long as you feel well, you are well. We will fight with you. So I thank you. This is actually the road well-traveled. That was the path around the Charles River, and that was Bill Rogers. He and I ran together in May, and on one of the greatest days of my life. So thank you, and I encourage questions.
Thank you so much, Dr. Wolf. I think what the audience, both here in the room and around the world, have seen is that there are advances being made. It's important that we have people who educate other doctors about history taking, about procedures that are now available, screening tests that we're not utilizing as well as we should.